the Healthy Living Series Challenge. This week, we are going to take some time to talk about preventive care, which is an often overlooked but highly important part of our health and well-being. I want you to ask yourself a question. When is the last time you had a preventive care appointment? Some of you may say a few months ago, and some of you might say, oh wow, I think it's been a few years since I last saw a doctor. Chronic diseases are on the rise, and according to the CDC, 7 out of 10 deaths in the U.S. are from chronic diseases, and most of these diseases are preventable. The purpose of preventive care is to shift the focus from treating sickness to maintaining our health and well-being. It means going from reactive to proactive, seeking to avoid disease way before we even feel sick or notice any symptoms of illness. But this doesn't only include visiting your doctor once a year. It also includes taking on a healthy lifestyle, exercise, nutrition, lab tests, counseling, and immunizations. Can you believe that Americans use preventive care services at half the recommended rate? Reasons why you need to be on board with preventive care. First, you can catch what's going on with your health and get more effective treatment. In our modern day, we have access to some amazing screenings and tests, which allow us to catch diseases before they start. This can mean that we can make necessary changes, like lifestyle changes, or engage in treatments while in early stages to help us recover more quickly. You can also reduce your medical expenses. Using preventive services can lower your long-term cost of care because you are actively involved in your health. Many preventive care services are fully covered by your insurance to relieve any financial barriers that keep people from utilizing them, so it's important to be in the know of what is covered. Sometime today, take some time to investigate what preventive care services and screenings are covered by your insurance. If you're having a hard time finding or understanding this information, give your insurance a call. They'll be happy to help you discover how to let your insurance work for you and your preventive care needs. Don't let lack of knowledge stand between you and your long-term health. A great first step is an annual physical with your doctor. This is something that should be covered by all insurance, and it can open the door to conversations with your provider about exactly what screenings, tests, and other services you need for your preventive care. Your doctor will know your personal and family history, and they'll have an understanding of risk factors to guide you. They will also be able to order any tests or refer you to any specialists that might be helpful in any preventive care you need. Schedule an appointment today to have an annual physical with your doctor if you haven't had one this year. Like we mentioned earlier, while seeing your doctor for an annual visit is a great and commendable thing, it isn't the only part of preventive care. Good preventive care also includes taking on a healthy lifestyle, including exercise, nutrition, lab tests, counseling, and immunizations. Guidance on lab tests and immunizations will come from your provider, but they might include things like a flu shot, which you should receive every year, the Tdap vaccine, which protects against whooping cough, which is something you should get if you didn't receive it as a child or a teen, and then the TD booster, which is for tetanus and diphtheria, which you should receive every 10 years. It might also include the shingles vaccine, which is recommended for healthy adults age 50 and over, the pneumococcal vaccines, which are recommended for some adults 65 and older or younger adults with certain conditions that might weaken the immune system. Your doctor also might talk to you about blood work for chronic diseases like high cholesterol and high blood sugar. These tests are very important, as these conditions often don't show any symptoms at first, but are much easier to prevent, reverse, or treat when noticed early. It's recommended for all adults ages 20 and older to have their cholesterol checked every 4 to 6 years. Glucose should be checked every 3 years, or annually if you have prediabetes. Finally, your doctor might order any other lab tests that are appropriate based on the things you discuss in your appointment. For a magic pill for your health? Well, exercise is pretty much as close as it gets. Exercise is beneficial and therapeutic to so many chronic diseases, and there are tons of studies backing this up. Everything from osteoporosis to diabetes to heart attacks to cancer can all be improved with exercise. Not sure where to get started or how to get motivated? First, rather than exercise, thinking of moving your body as just that, movement. When you were a kid, you didn't dread going outside to play. You thrived in those moments, playing outside with friends, biking around the block, or climbing trees. Try incorporating whatever fun you loved as a child to your movement now as an adult. Were you into climbing trees as a kid? Rock climbing would be a great form of movement for you now. Did you love playing games with the neighborhood friends like tag or Red Rover? Maybe now you would love joining a league to play kickball or volleyball with others. Also, start where you are and celebrate the movement you do get. Don't get caught up worrying about hitting the recommended number of minutes right away. Even if you just get 10 minutes of movement here and 10 minutes of movement there, you are giving your body a great gift. Body combat disease in many ways. Everything from vitamins fighting off infections, to healthy fats protecting your heart, to antioxidants that are protective from cancer, and more. There is a ton of information out there about healthy eating. Some probably to be avoided, like the fad diets galore, and lots of great information and plenty of true professionals that could coach and guide you. Nutrition for preventive health can be kept quite simple though, especially if you're just starting to try to eat healthy. Overall, stick to these principles. First, aim to stick to whole foods. This means eating food as close to its natural form as possible. In nature, you can find lots of good food that you're familiar with. All sorts of fruits, vegetables, nuts, beans, whole grains, and so forth. However, you will never take a walk outside and stumble upon a field of bacon cheeseburgers or a crop of Twinkies. Eating food that you can find in nature will give your body tons of nutrients beneficial to your health. Meal planning doesn't have to be overwhelming. When filling your plate, try to follow the Choose My Plate model pictured here. As you can see in the picture, when you fill half of your plate with fruits and veggies, a quarter with good lean protein, and 1/4 with grains, you have a balanced, healthy, and probably very colorful and appetizing meal. Third, eat plant-based proteins and foods when possible. This doesn't mean you need to go totally vegetarian or vegan. Rather, by choosing to eat some plant-based meals, you allow your meals to be filled with more plant-based proteins such as legumes and beans, which will offer extra protective health. Could you try going plant-based just 1 or 2 days a week? Finally, practice moderation in all things. When eating for preventive care and for health in general, you can and should still enjoy the foods you get to eat. After all, healthy food is delicious. Rather than depriving yourself of your favorite things, eat them occasionally, in realistic portions, and mindfully so that you truly enjoy the treat. To your mental health as well. When your mental health is suffering, it is crucial to seek help. It is a sign of strength, not weakness. Having someone to talk to, think things through with, and just an extra unbiased set of ears is so helpful. This type of care is truly preventive care as well, because like all preventive care, seeking help with our mental health allows us to take good care of ourselves before our health reaches crisis level. Mental health services are also typically covered through insurance. Your insurance may include counseling, substance use disorder services, an EAP, which is an employee assistance program, and more. Look into these resources and get connected with whatever would be beneficial to you or your family. As always, we sign off with a reminder to have fun. We hope you have enjoyed this Healthy Living series. Remember that a healthy lifestyle is a lifestyle that you find fulfilling, energizing, and of course, fun.